Hi, I'm going to talk about how I apply the clinical judgment model when caring for oncology patients at the end of life. Since I work in oncology, this is something I experience often, and it's in an area where nursing judgment is especially important. First, I start by recognizing cues. In my patients, that might look like increased pain, more fatigue, changes in their breathing, restlessness, or decreased appetite. I also pay attention to their emotional and spiritual cues. Maybe the patient seems withdrawn, fearful, or is asking deeper questions about dying. Family dynamics are also important cues, especially if they're struggling to accept the prognosis. Then I analyze those cues. I ask myself, is this a symptom, uncontrolled pain? Is this disease progression? Are we transitioning into the dying phase? I also think about the patient's developmental stage and the cultural beliefs because those are really important and impact how they cope and make decisions. Next step, I prioritize. At the end of life, comfort becomes the priority. Pain control, breathing comfort, dignity, and honoring the patient's wishes are most important than aggressive treatment. Then I generate solutions and take action. I collaborate with the providers for medication adjustments and use non-pharmacy comfort measures involving palliative or hospice care. And most importantly, I communicate clearly with the patient and family. I spend a lot of time arranging for hospice and end-of-life care and also educating the patient about what to expect because fear often comes from the not knowing. Finally, I evaluate by reassessing the comfort and emotional support. If the pain isn't controlled, I always reach out to either the pain management or palliative care doctor, and I advocate for changes for my patient. If family is confused, I always provide further education, and I'm the first one that they contact to make sure they understand what's going on. Using this model helps me apply the nursing process in a structured way while still providing compassionate, individualized, and safe care to the oncology patients at the end of life. Everybody deserves dignity and respect at the end of life.